Forward to seeing y'all in more meetings and learning more about pulmonary fibrosis. And this is Bill Vick, who everybody knows. I don't think we need much introduction. So everybody look at Bill.
Hi.
Hi.
I'm the Baptist.
I think
You can hear me without it, can you? Yeah, welcome. And I'm pleased to see you show up with something like this. I think it's so important for us, patients, caregivers, families, to have a chance to talk with each other and learn from each other and support each other. And that's what it's all about. I just want to talk a second about the PF Warriors of North Texas and what it means, hopefully it means the same thing to you. I saw the opportunity this last year, one of bringing patients together. If you look at the numbers, I'm kind of a numbers guy, there's about 1,600 IPF or PF or ILD patients in the Dallas-Fort Worth metroplex. And that's kind of defined as an area between Tyler and going out to Mineral Wells and north as far as Oklahoma City and south to Austin. So there's about 1,600 of us in that area. And there was no way for them collectively to be involved in support meetings to help each other and learn from each other and others, as we did this morning with Dr. Trombello. So I put together this concept, which is now sponsored by the Pulmonary Fibrosis Foundation. And we're independent of the hospitals and medical centers. So we're not affiliated with Baylor or with UT Southwestern or with soon to be announced Presbyterian. We're independent of those organizations. And we support all of them. And we try to support all of the patients that attend to those different hospitals and medical centers. Ultimately, we have right now about 180 people that have registered with us to come to meetings like this. And we have varying numbers. We've had, I think the high was 102 people in the meeting, and we have smaller meetings like this, 20, 25 people. But again, the opportunity, I think, is to talk to each other. And I'd like to really recognize three people that I think make these things happen. And first is Steve Winnell. Just raise your hand, Steve. Steve is doing the videos for us that we put online on our website that recap the meeting. And Steve does a great job, volunteers his time, his resources, and his equipment to do that. And I want to say thank you, and I mean that, Steve. And John Rost, John is inspiring me. He's a transplant patient, very much involved in helping further ideas and research and living with pulmonary fibrosis. He's a living example himself. And John is running the virtual side of our meetings using a product called GoToMeeting. And there's good and bad in GoToMeeting. The good is it lets people, like Tyler as an example, who can't come to a meeting attend it and participate. And I think that's a good thing. The bad thing is sometimes we miss this opportunity of interacting with each other. And I think that sometimes is important as what we learn or what we hear. It's a really important thing. And that's John Ross. And then, of course, last but not least is Shelley Mathis. And Shelley really makes these things happen. She's the one who put the meeting together, her and her team. And you have 8 or 9 people on the show. They're helping her structure the meetings, attracting speakers, setting up the facilities, doing all the heavy lifting. So guys like me can smile and dance in and dance out again. But Shelley Mathis is really, I think, the one that gets the lion's share of recognition in our meetings. So she really does what I call heavy lifting. And with that, I'd like to turn the meeting over to Shelley to introduce our speakers. And thank you, Shelley.
Thank you. Good morning. Before I introduce the speaker, I would like to mention all the people that work on my program committee. I know some of you are here. I saw John Hill and Mike Daly. We also have Heather Cagle, Ginger Connolly, Larry Elsley, Debbie Bryan, Marcia Slater, and Susan Grimes. And of course, it is August in Texas, and a lot of these people travel north. Also, the rest of the lineup for the rest of the year, September 17th, which is not the normal day for PF Warriors to have their meeting, But the UT Southwestern and the France Foundation, I don't think they have anything to do with France, but anyway, it's a medical education nonprofit. They are having a special program on September the 17th at UT Southwestern on facing pulmonary fibrosis together, a team-based care approach, so they wanted us to participate in that. And so we rescheduled our October 8th meeting to UT Southwestern, and we're going to have that one on lung transplantation with a Baylor doctor, Dr. Garcha, and a panel of transplant patients, some of whom are in the audience today. November 12th, we'll be back here at Baylor. Noah Greenspan, I think a lot of you know him from his Pulmonary Wellness Facebook page and all his videos. He's coming down here from New York City to discuss comprehensive pulmonary wellness. This will be his first trip to Dallas, so he's real excited about it. And if you've seen him on the videos, he's excited about everything, so he'll be really great to have. So today we're really lucky to have Dr. Joseph Trombello, an assistant professor in the Department of Psychiatry and the Center for Depression Research and Clinical Care at UT Southwestern. As a psychologist, Dr. Trombello provides psychotherapy involving behavioral activation and cognitive behavioral therapy for mood disorders. He also has expertise in couples and group psychotherapy. He offers training, supervision, consultation, and education to staff members and providers at primary care clinics. He is particularly responsible for enhancing patient and provider education on mood disorders, diagnostic interviewing, and risk assessment. He also supervises psychology graduate students and psychiatry residents at SMU and UT Southwestern on their psychotherapy patients. So I don't guess you can have any free time to do anything else, but we're so grateful that you come here today to talk to us about how to develop the mental and psychological strength to deal with pulmonary fibrosis. And join me in welcoming Dr. Joseph Trombello.
Well, hello everyone. Thank you all so much for your time. Really grateful to get to be here and really looking forward to getting to meet and speak further with everyone later today. Can everyone hear me okay? That's not doing okay. Raise your hand or something if you can't. A couple of plugs. In the hallway outside, and we have some notepads if you want to take some notes and some information with my contact details. If you didn't grab one, please feel free to grab one after the break. As you may now know, I don't necessarily do pulmonary fibrosis work. My work is primarily in a big research lab for mood disorders. We have a few depression-based research projects active. If you want to hear more about them, I'd be happy to talk with you further about them. But really grateful to be here today. In speaking with Bill and Shelley and Ginger, y'all are the experts on pulmonary fibrosis. You and your close others are the experts. So we're going to have some time to talk about what this is like later today. I wanted to sort of come in and share some pieces of it. I certainly get the sense that pulmonary fibrosis diagnosis is obviously a major life-changing diagnosis, not just for you, but for your close others, your partners, your spouses, your friends, and your family members. So how do we help everybody deal and cope with that? So I want to talk about a few concepts here today that may be of help to you. Please don't hesitate to interrupt, questions, comments, here or privately on the break. And in the last half, we'll break into some small group conversations about what you heard, and then bring everybody back together at the end for larger group conversations. So first thing I thought of when I learned more about the topic is, wow, what a major life-changing event. And when I work clinically with folks who are dealing with major life-changing events, I try to think about and help them think about how do you live the life that you want? How do you get to do what you want to do, even if something major has happened? Whether it's a chronic medical condition, whether it's a job loss, whether it's the passing of a spouse or a close other, many things. How do we help you do the things that you want to do in spite of that? So therapy concepts I work with are around the concepts of values. What are your values? What's important to you? How do you get to do what it is that you want? Maybe you have to make some changes or some accommodations in the discrete behavior that is attached to that value, but maybe there are other ways to get those values met. So if it's important to be intimate and close to your romantic partner, how do you get to do that if things happen that there are some, sort of physiological changes? If it's important to travel, to spend time with friends and family, to connect, how do you get to do that? Maybe if travel is more, sort of limited, or if funds are more limited, things like that. So I'm not going to go over every detail on all of these pages. Happy to send these out or to share those with you some other way. But basically this is an exercise I take clients through, the concept of a bullseye. So how close are you to your targets in certain areas? The 4 areas that we often talk about are work and education, social, interpersonal, romantic relationships, personal, growth, health, wellness, and leisure, fun. So I take my folks through an exercise, which is 2 things. The first is, so, here's the bullseye mapped into these 4 quadrants: work, education, leisure, personal growth and health, and social relationships. First thing, how close are you to where you want to be? So I have folks think about these 4 areas, write a little bit, think about what their discrete goals are in these areas, and then mark, how close are you? Are you living in accordance with your values or not? Obviously, remember from when you play darts, the closer you get, the more points it's worth. So in some of these areas, you may be very close to the target, and in some other areas, you may be farther away from the target. All of that is fine. All of that is fodder for conversation. How do we help you get closer to what you want to be? So think about the changes that you and your close others have experienced since, both, before and after your, diagnoses. How do you and your close others get to do the things that you want to do? That's really the first concept. I'm going to keep going. I want to just do some quick hitters about several of these topics, but please don't hesitate to interrupt me if you have questions or comments. And we'll get some time to talk about this more fully in the small and in the larger group conversations. Any questions, reactions, comments from anybody? Jump in if you do, please. In speaking with Shelley and Bill, I learned a lot that obviously this is a disorder that affects how folks breathe, and there can be panic-like symptoms or difficulty breathing that is pretty distressing for folks. So when I deal with folks who are experiencing panic, whether that's due to a chronic medical condition or not, this is a situation where by definition our bodies and our minds are primed into this fight or flight response. From an evolutionary perspective, when bad things happened way back in the day, we had to be primed to learn how to deal with it, otherwise we were going to be eaten or killed. So we all have biological, physiological, psychological mechanisms that prime us up for when we should be afraid. But folks who are dealing with various degrees of anxiety, that system operates a little too quickly or a little too often. So that's a big part of what we talk about. When you're feeling really anxious, you often get primed for this flight, oh my God, something really bad is going to happen kind of a response. There often can be a lot of anxious, a lot of hyperventilation, a lot of quick breathing, and various other physiological symptoms. So the two ways I work with my patients, and you'll kind of see this theme throughout, both at the cognitive level, what are you thinking? Let's say you have a thought, oh my gosh, I'm having this breathing attack, it's so horrible, and it's gonna last for such a long time. Obviously, when you're in the middle of really scary stuff, it feels really scary, and it feels like it's really awful, and it's gonna last a really long time. You obviously know this much better than I do, but I have the sense that probably these spells come and go. So when you're in the middle, it feels really bad, feels like it's gonna last a long time, but maybe you have some evidence that suggests, well, actually, I can cope, I can manage, there are ways I can get through that. So partially it's about changing the way that we think from this, oh my God, this is so horrible, to something like, hey, I've dealt with this before. This isn't the most fun, but I've dealt with it, I've learned from it, I know I can get on from this, I know it's not gonna last very long. Changing our thinking can help us sort of dampen down that fight and flight, that really high-level anxiety response. And then also at the behavioral level, we want to continue to do things, again, back to where I first started with, things that are in accordance with our values, so that we're not running away or being afraid from the things that may produce these attacks. When we avoid, that is the hallmark, avoidance is the hallmark of anxiety. That's what maintains our anxiety, because we never get a chance to learn, to realize that something different may happen. So, I tend to deal with folks who have lots of, kinds of anxiety. They're afraid to drive, they're afraid to travel, they're afraid to go out of the house alone, things like that. So the more slowly over time I can help folks make small movement towards that, the more they'll be able to get things back into their life that they enjoyed, and the more they'll realize, hey, that wasn't so bad. I can cope, I can manage with that. So that's really the crux of this concept. Questions, comments, reactions? Am I going too fast, too slow? Good. Good.
I guess my comment would be, I have these panic attacks,
Yeah.
and I think it seems like it starts off, it's physical.
Yes.
Like I can't get enough air, and I think I'm going to drown, or
Yes.
whatever.
Yes.
And man, it's really hard to get your brain to say, it's okay. You've done this, you're going to get it. But
Right.
I don't know how you change that behavior
Right. Sure.
to not be flight.
Good point. Good point. So it's a process, right? And any change, there's a lot of steps and a lot of practice that goes along into it. You have a lot of experience, a lot of evidence that suggests your automatic way of thinking is it. So overnight, that's not going to change. I'm not going to wave my magic wand. It's going to take some time, but very slowly over time, when you notice those very first physiological symptoms, when you notice those real triggers, those real trends, slowly you might begin to think of something slightly different. Rather than jump right away, you can think, hey, remember what Dr. Trombello said, this is something I've dealt with this, I've learned with this, I know it's passable, I know it's not going to last that long. And so it takes a lot of practice and a lot of time. So I fully respect, you're right, it's not easy and it's a process. But the more you notice what those triggers or what those symptoms are, that's the first step. And then slowly think about something a little bit different. And over time, that process, that alternative process will become more automatic. Great point. I saw there was another hand up, another comment.
I just had a suggestion. Everybody should go to pulmonary rehab because it's not mandatory. You just either ask for it or they suggest it. But it really helps show you how to breathe differently.
Yes.
And I didn't know there were so many different ways to breathe.
Yes.
So you can use different ways.
Exactly. When I work with my patients around breathing, I often teach a very deep breathing exercise. Breathing from your abdomen, breathing slower, because naturally we often breathe from our chest, from our lungs, but my gosh, when there's a lot that's going on that makes that hard, it can mimic panic. So I do a lot of breathing retraining about, breathing from your abdomen, breathing from your lower, put one hand on your abdomen, one hand on your chest, focus on breathing from that lower hand. And there's lots of resources available. The website I always refer folks to is MARC, M-A-R-C, .ucla.edu. So this is the Mindful Awareness Resource Center through UCLA. UC California, Los Angeles. They have a number of breathing, sort of guided breathing exercises, and some of them deal with those principles. Great point. Anything else? This gets back to a little bit about what we've talked about. This is a handout dealing with the cognitive model, a really important tenet in cognitive behavioral therapy. But it stems from the idea that we have an event, things happen to us, we have an event, and we have a choice for how to think or how to interpret that event. So let's say the event is, it's really hard to breathe, your chest feels really tight, you're noticing that maybe one of these breathing spells is possibly coming on. So that's the event. There are different ways to think about the event, as we've talked about. One way is, oh my God, I don't know what I'm going to do, I won't be able to cope, this is really hard, I feel really bad, it's going to last a long time. For many folks in the room, that may be a more automatic way of thinking. That's maybe what comes first. I imagine, and again, you know yourselves much better than I do, but I imagine if folks were to think that way, they may be feeling more anxious, they may be feeling more amped up, they may be focusing even more on their, sort of physiological sensations and on how difficult that is. And that may lead to certain behaviors as a result. It may maintain that sense of anxiety. Or it may lead folks to not do, to actually avoid people, places, or situations where they think this maybe breathing spells are going to come on. As we said earlier, there may be some different ways to think about what happens. An alternative might be something like, hey, it's okay, this is hard, but I'm going to get through it. I've been through it before. I know it typically lasts only a few minutes, and I'm going to move on with my day. Again, tailor that to whatever feels best for you. You know yourselves better than I do. So it's the same event. We're dealing with exactly the same event. We can't always control the event, but we have more control over what we do with that. So different ways of thinking or interpreting about that event may lead to different emotions. One might feel more calm, one might feel more relaxed, and to different behaviors. One might feel more likely to go out and do things, be around people or places or situations, even if they think one of these spells is going to come on, because they know how to cope and manage with it. It's no longer such a terrifying event. Again, something that happens in time, it's a process. Anything about that? Really big piece I talk about, primarily for depression, but also for anxiety and for lots of things I deal with. Again, harkens right back to that first handout about values. When we feel bad, when we feel sick, when we feel tired, when we feel anxious, when we feel depressed, whatever it is, we often stop doing things that we used to enjoy. Naturally. However, oftentimes we find the less we do, the more tired we feel, the worse we feel, the less we want to do. And so it creates this cycle. All of these components are interconnected. So when we're not very active, when our behaviors are not very active, again, we're decreased in our activities, we're perhaps withdrawn socially from other people, we're not as productive, we're not getting the things done that make us feel good to do. That may lead us into some negative thoughts about ourselves and the world and other people, may lead us to feel sad, may lead us to feel lower in self-esteem. We may focus more on the challenges, on the things that are not going well in our lives, on the medical or family or work or other problems that we have. And we may notice more physical symptoms from this. sleep, poor sleep, more pain, poor energy, poor concentration. Perfect example for me, I know when I get home from work, I'm really tired. I avoid working out a lot of times because I'm really tired. Well, that makes me more tired. So I have to do something to change that up, and I have to push myself and say, even when I really don't feel like doing this, maybe I should go ahead and do it because I know that's going to make me feel better after I do it. My example, I think we all have those examples. Ugh, I really don't want to do this. So a big thing I push, I work with my folks around is first, of course you wouldn't want to do that. When your energy is low and your motivation is low, we often don't want to do those things. But that's when it's even more important to do what you don't want to do. So is there something you can tell yourself to promote yourself? Hey, just get started. I really don't want to write this paper sometimes, but maybe I can just write for 5 minutes. Just write 1 or 2 sentences and then see what comes up. I don't want to work out, but let me put on my shoes and let me go for a walk around the block just for 5 minutes. Maybe I'll be feeling more motivated afterwards. And I think often what I can get folks to, sort of acknowledge is, hey, yeah, I can think about sometimes when I didn't want to do it, but I did it anyway, and then it was easier, and then it was better, and I was really glad that I did that. So a big focus of the kind of therapy I work with is how to help folks schedule in some small, pleasurable activities that they want to do, and that are medically advisable for them to do, and that they enjoy. If someone told me I'd have to go and run a marathon, I'd look at them the other way. That's not going to work for me. So I need to think about things that I'm going to enjoy doing that are going to work for me. So in a similar way, we all have different interests, different passions, different skills. Can we help folks do a little bit more of that on a day-by-day basis? Again, it's a process. Questions here? A couple more handouts I want to talk through. I'm going to come back to this in a minute. I'm moving on to the other, let me start here for just a second, excuse me. I want to talk about a couple of skills that are about how to communicate with close others, how to ask for what you want, and how to listen when a close other is asking for something. I know that chronic medical conditions, many other stresses and challenges impacts not only ourselves, but on really close people around me. I do a lot of couples therapy, I do a lot of couples research, that's my passion. So I get it. It's not just hard on you, it's hard on a lot of other people. So, and we're going to do some small and larger group conversations about this, but one thing is how to ask for what we want. The acronym to remember is a concept called DEAR man. The D stands for describe. So as clearly as you can, state what you need. The E is to express how you feel about that. We often talk about using using the word I, using, sort of I statements. I feel X when you do this, or I feel X when this happens. Because that's a way to get the other person more linked in to really understand what you're going through. The A is for assert, and both verbally and non-verbally, try to clearly ask for what you need and just come out and say it. The R is to reinforce. If you do this for me, honey, this is what I'll do for you, or this is how it will help me, and this is how it will help you. Right? So sometimes you have to give a little to get some of what you want. The M is about being mindful, which is just a fancy way of saying be really focused on what it is that you're wanting. And if someone tries to get you off track, keep coming back to that. Concept we use is be like a broken record. Just keep stating your point if someone really tries to derail you. The A is to appear confident. And this is more non-verbally, right? We all know if someone is, well, hi, maybe can you do this for me? That's not very assertive, non-verbally, versus hey, honey, listen, this is really what I need from you, right? So not only what you say, but how you say it. So the A is about being assertive and confident. And the N, we've sort of already talked a little bit about this, but again, this is about maybe giving a little of what you want. If you do this, you know, I'll do this, that kind of thing. Really, the other hallmark is interpersonal effectiveness is knowing what you need from the other person, how he or she is going to best respond to you to help you get what you want. And we all respond a little bit differently. So the example I use is I've worked for my boss for 3 years, and I know if I need him to do something, I have to camp outside of his office and get him to respond to that email or to read that paper or whatever. That wouldn't work for a lot of people, but I know that works for him. If I did that with, you know, sort of another, you know, coworker or colleague, that wouldn't go over very well. I know with her, I need to send an email. And I know for her, I need to send an email between this time and this time. Anyway, right? So it's all trial and error, and it's all about you're going to use different strategies to get what you want from different people, because different people respond differently. So just kind of the overarching framework there. Want to jump really quickly into some of the listening skills, but anything on this point. Maybe in the break, take a minute to think about what you might want to ask your caregiver or your family member or your, you know, close other, and maybe on the car ride home or at lunch or something. You can have a little practice of that. Quickly, I want to talk about some of the skills to help folks listen. It's really just this first part here. The acronym is called GIVE. So obviously, when we're in the heat of the moment, when we're feeling really impassioned, when we're not feeling well, when really tough things are going on, it's natural for both parties to get a little riled up. Sometimes we may find, though, that that's counterproductive to the kind of conversation that we want. So the G is about be gentle. Don't attack, don't threaten, don't judge, just listen. Going along with that, the I is about being interested and avoiding trying to interrupt. So when I do a lot of couples therapy, I'll turn to one partner and say, tell me a little bit about how you're feeling about this. And they'll say a lot sometimes. And sometimes I have to hold off the other partner. Hey, just a minute, I know this is really important. Don't worry, we'll be able to get back to you because I really want you to hear what your partner is saying. So person A talks for a little bit, and then I turn to person B and say, well, how did you respond to that? And they'll talk for some time. And may have to hold off person A, and so it's this kind of thing. I know our society, you know, we're on Twitter, and every communication is so short and so fast and so clipped, and we're so active. But some of the tenets of good active listening, just let your partner go for just a little bit. You'll get your turn, don't worry. V is about validating. So you've heard me perhaps say things like this already. I totally understand what you're going through. That must be really tough for you. That sounds really hard. I can really tell you're really tired. So comments like that that show that you're appreciating, acknowledging, understanding what the other person is saying, and that you're labeling and sharing in what you think their feelings are. And then the E is to have an easy attitude in your tone of voice, in your smiling, in your body language, right? Hopefully I'm modeling a little bit of that, right? If I started shouting at you and waving my finger and things like that, works for some of the Olympic swimmers maybe, but not so much for us, right? So that wouldn't be a good way to communicate with it. So again, it's about being easy. I am coming to the end. Questions about that? The last handout is a little bit of a summary handout, and it promotes how do we help folks be well and stay well. This is a handout that our group has come up with. None of this is really rocket science per se, but a lot of this are just things that sometimes in the heat of the moment or when we're feeling really down or really bad, we often forget. So it's things like with your body. Try to stay a little bit fit and a little bit active. Be balanced in your eating, in your rest, in your sleeping, in your water, in avoiding substances or things that may not be good for you. So at the physical health component. Then in terms of your mind, we've talked about this a lot, but developing a strong support network. Friends, family, close other people, other folks here in your support groups. By definition, this group is about this topic, right? Also develop a good professional support network, your doctors. Doing things to reduce stress and calm yourself down. Again, it's going to work a little differently for every person. Different things make us feel better. We've talked about this, some of the cognitive piece. Avoiding maybe some of those negative or some of those anxiety or some of those sort of depression-producing thoughts and focusing more on more balanced ways of thinking. Then, and again, this may come up a lot for this group, but at the spiritual level, whether you subscribe to a particular religious group or faith or not, some people believe and get benefit from spirituality, religiosity, mindful meditation, whatever it is. Now, of course, the other side, I might imagine that when really bad things happen to really good people, that can sometimes test our faith or test our spirituality. And maybe that's something that comes up at time for some people. So I want to acknowledge both sides of that. But anecdotally and even from a research perspective, I know that some people get benefit from whether it's religiosity, spirituality, meditation, neutral ways of thinking, things that kind of connect with things or people or places or experiences higher than themselves. So again, this group is a great example. Look how much advocacy, passion, support, meaning there is amongst all of you. This kind of a group sounds like a really great way to give back and to help provide meaning in one's life. So just wanted to sort of talk about that as a summary document. How'd I do? Questions, comments, reactions? Sure.
It's a question, comment.
Sure.
When I was early diagnosed, first I went through that period of depression with many patients. My general practitioner was too anxious to throw drugs at me. And so I went into Wellbutrin, which I got off. But still, I think that it's a kind of knee-jerk reaction. Well, you don't feel good, take this.
Right.
Is that true of most people or that you see in your practice?
It's a good question. I think what I will say is, now obviously I work for a psychiatry department, and I work in a medical center, and I'm a psychologist, so I don't have the training skills, expertise to prescribe medication, but I consult with doctors and providers who do and help provide some education for what they might do about that. Some medications work great for some people. Some medications don't work well for some people. Some work well for some people and stop working. There is a lot out there. Our group is researching actually some non-medication, some non-antidepressant medication treatments for anxiety. So our field, we're doing things like ketamine. We're doing low-frequency magnetic stimulation. Our field is moving beyond just therapy and antidepressant medication as potential treatments for depression. So there's a lot out there. Medication works well for some people. It doesn't always work well for everybody. I work with the providers in the community to help folks, hey, if one medication didn't work, this is what we would recommend next. Going to a different dosage. Switching a different dosage, adding another medication. So there can be a lot out there and a lot of choices out there if something hasn't worked. But I see a lot of people for the therapy I do because they say, hey, I don't want to be taking meds. I want something different. So that certainly is an option. I would never want to tell anybody what they should or what they shouldn't do in terms of treatment. You all know what works best for you, and I want to support you and validate you in whatever you do. There's some research out there that suggests patient matching. So someone comes in and says, I want to do therapy, and then they're assigned to do therapy. Patient matching tends to produce slightly better outcomes. There's also some research to suggest that especially for really severely depressed folks, the combination of medication and psychotherapy tends to work a little bit better than either by themselves. But again, that's at a broad level. You know what's going to work well for you. Maybe I talked around your question too much. Did I answer?
Well, I know in my case,
right.
I discovered, which John will talk about perhaps at some point, with Marxism and his whole concept about primary living. And part of that was becoming very active. And that offset all that.
Yeah.
I don't take any drug.
Yeah. So, right, they work on different kind of biological mechanisms, right? And there's so some evidence to suggest that the psychotherapy, what's learned through psychotherapy, tends to last a little bit longer than what happens, sort of on a medication and if you go off the meds. But I have to tell you, I see a lot of folks who are in really, really tough straits, and sometimes they go on meds for a little bit, and then they can start to feel well enough to get to do some of the things that I'm talking about. So I've seen it both ways.
When we told you to die, it's the present.
Oh. Of course it is. Of course it is. But I heard laughter when that comment was made too. So there are, obviously I don't want to make light of it. I know this is a huge, life-changing, grave diagnosis, but you've learned how to live and how to cope and how to manage with it. And there are different, sort of stages and different parts of, sort of development that happen after we get really difficult news. And that's something that I could have said more about, but, there are different, sort of stages of grief or of loss, and we do find folks work their way through, and, bad things happen. That doesn't always mean that folks stay in that bad place forever. There can be movement and change and growth. In the couples field, sometimes really difficult things can actually bring the couple closer together. Not at first, perhaps, but over time, there can be growth that comes from it. So, great point. Other questions, comments, reactions?
When you were talking about patient matching, and then is that matching a patient with another patient who would be mentoring them? Or?
So, yeah, good question. No, it's really more about matching the patient with the treatment that they have said that they want to come in for. So, a lot of research studies, our group does some of them. This is what we're doing. If you want to do it, great. If not, we'll help. There's only maybe one or two options available. But there's been some research looking at, okay, we can assign you to therapy or to medication or to both or to something else. What do you want to do? So there's been some research looking at kind of that sort of matching. I didn't mean the sort of mentorship approach.
Well, I'll tell you what, luckily for most of us here, we know Bill Vick. I mean, when you read things online about pulmonary fibrosis, it's horrifying. Really, it's the most dismal information that finally, I went online and said, who is doing well with this disease? And Bill had just run a marathon, and some sports magazine had written about him. So it popped up that he was doing well. So matching you with a patient who is doing well, and kind of can show you a path. It was very meaningful for Scott and me.
Good. No, I'm so glad to hear that, and boy, that's such a great, testament and vote of confidence. But right, I mean, your group, it sounds like it's about the support, the advocacy, the mentorship, the learning from each other. And we're going to, again, as we transition into some of the small and larger groups, we're going to give you all a chance to continue to do even more of that here today. But great point. Sure. Anything else, other questions, comments? I think maybe I heard.
Are we going to have access to these handouts?
So great question. So I have it available and I can, so you have it through the email?
It's going to be on the website when we have, this video will be done in about a
Okay,
week.
perfect.
At that point in time, you'll be able to click and download the PDF.
Okay, perfect.
Thank you.
Perfect, great, thank you.
I have another one.
Sure.
I think, at least for me, Bill's always explained this, that we're all on a bicycle ride, going downhill and different speeds and different things.
Right.
And I'm usually pretty positive about all this. And I guess I've adjusted it, accepted it. But you have those little things that happen, that you drop a little bit, and then now you got to adjust again. Then you got to adjust again. And it seems like you lose little pieces of what you used to be able to do every day. And that gets constantly frustrating. And I guess makes you mad, too, that's happened. And so, you know you want to be positive, but it's really hard. You really have to work at it. And the other thing is, I think we're all different, but we all need to know that there's some things that happen that we're all experiencing. The same thing that, hey, it's okay. If you feel that way, you feel that way.
Right. Yeah, thank you so much. That's a great comment. You're right. Everyone goes at different speeds and paces, and yet there are probably some things that are quite common to folks in this room, and you're learning and growing from each other. How do you handle those setbacks? How do you handle the frustrations? How do you stay positive? Again, first handout, how do you live the life you want in accordance with your values, even if you can't do that one thing that you want to do? Is there another thing you can do that taps into that? Right. So, but good, yeah, great point. You're right, it's not easy. It's not easy. And you're learning and growing from each other and from anything else. I'm under the impression we'll want to take perhaps a little break. I'll be available, and then we'll come back and, I don't know, how are we for
We
time?
have a breakout group, or, yeah, Tammy, you have the parking passes, I guess, somewhere, and
Yeah,
tell
before
us.
people leave, I've got them to pass out.
You want the caregivers to go to the other room and the patients?
It's called the medical room, which if you just go straight down that opposite hallway, it'll be on the right-hand side, a few
Okay.
doors down, with the restrooms being on the left-hand side of the break.
The patients are sitting here.
Is patient staying in here then?
Whichever one you would like. Patients in here, so they don't have to move, and then we'll do the caregivers down the hall.
Okay.
So in 10 minutes, that would be 5 or so after 11 to just go to your respective rooms. Oh, my watch is slow. I need a new watch. Okay, 10 minutes. 10 after. Yeah, you don't want a Rolex. That's the worst.
Oh, that's okay.
You don't need any-
I don't need any president yet. Just wanted to give just 1 or 2 minutes for.
Patty?
Oh, sure. I'm not going to say. Well, thanks everyone for your time and your courage in talking about what your sort of experiences were. I know there probably were a lot of emotions brought up in both rooms, so thanks for being willing to go there. really big thank you to Tammy and Paula, who did a great job in leading the groups. I'm really grateful for their help and support. We had just a few minutes, and I just wanted to give just a couple of minutes just to sort of recap, or maybe, sort of summarize. Oh, sorry.
Screen isn't, you're getting those lines on the
Okay, that's not a good look, yeah. So I just maybe wanted to give just a brief few minutes just to, summarize what was mentioned in each of the rooms. Would someone maybe be willing briefly just to summarize what the conversation was like in the patient room, what sort of general themes came up?
I think it was pretty much how we felt when we received the diagnosis and how we feel about our kids and projections and stuff like that.
And has that shifted over time, or has the way you felt shifted, or has it stayed?
I think mine has stayed the same, but I don't feel like I'm as far along yet to really give a,
You'd be good for that one.
Well, I just want to say in general that I appreciate the fact that they got some psychological input, because it's very important, like I said, for validation or for improvement, either one, because it is a traumatic thing to deal with.
Right.
And I'm still angry about the fact that it took me 3 doctors to find somebody that can do what I had.
Yeah. Yeah, I know. Sort of anger was a common theme that I heard.
Now, misdiagnosis is a recurring thing. If you look at Facebook support groups and things, you see that as a recurring thing of how long it took to be diagnosed. And some takes much longer. I know Bill's experience was several years. Mine was several months.
Right. Yeah. So again, each person's path has been a little bit different, and there are differences in that. Anything else really salient in the patient room that you think we all should know, or that might be helpful for the, sort of caregivers to know?
Yeah, I think that they need to know that we understand what they're going through, too, that we do realize it's a load on them, too.
Yeah, the conversations I heard were about sort of, well, this is really hard for my partner or for my close other, and sounds like it's really important to convey that, hey, we know that this is hard, and we appreciate all of what you do.
I think it's harder for the caregiver than the patient. The patients come to the acceptance. Caregivers never can. They're always seeking silver bullet. Always. This is the nature.
Well, it's certainly different. It may be different, right? There are different processes for both parties. I guess then maybe just sort of switching over to the caregiver side of things, any really salient themes or things that you would like the patient group to know from what you talked about?
Come on.
Caregivers.
Come on.
I'll bet somebody said something about wishing that the patients would be more compliant.
Actually, that's a come on.
What has it been like for, the patients have thoughts and have said what they think it may be like for you, but, from your own experience, in your own words, anyone want to share what it's been like?
I think one thing we all felt is, most of us, that you don't know what boundaries they have, like, don't do that, don't do that. You don't want to hover, but you want them to know you're there.
Yeah.
Sometimes everybody's different, and every week is different.
Yeah.
How much help you want to give or
Yeah, that's a great point. That really sort of resonated with me in terms of, again, kind of back to these interpersonal communication skills we talked about. What do you need? What would be most helpful? Is the oversight and the hovering, when is that helpful? When might that not be helpful? What else might you like? What else might be helpful? I think I also heard a lot from the caregiver room, we're trying to do the things that we think we can do to help care and love and support my, close other person. So the intentionality I heard was always about care, love, support, warmth, help. Sometimes maybe it may not feel like that, but that's at least what this, sort of intentionality was.
And you live with low-grade fear and anxiety, like if you don't think of everything that needs to be done or ask the doctor every question, that, so it might hurt your heart rate, somehow. You're suddenly responsible for this big monster saying, something. And it is a lot of anxiety. There's not enough alcohol in the world.
Well, we're close to some of the, sort of deep Ellum bars and breweries and stuff. Okay, any other comments or anything?
I'd just like to say one thing, and it may be very obvious, but to me, groups like this, because I go to some of the self-help groups, they're so important. I don't think a lot of people realize how important they are. Yeah, I definitely am glad that there's some people out here that are doing something about it, about providing, because I may know everything in the world, but I still learn something every time I come to it.
Good.
I think it's very important if you don't have somebody at home, which I've been single over 10 years, so I don't have anybody at home other than my girls who have their own families. So this really helps because, like you said, your friends, my family, nobody thinks you're sick at all. And so when you are climbing up a hill and you go, wait a minute, I have to catch my breath, or something, that's the only time they ever see you do anything like that.
So how do you help other people understand what you're going through, particularly if it may not be so obvious or prominent to other people? It's a great point.
And I think that's what came out of our group in here was that almost the full consensus was most of their friends outside of their close others don't realize they're sick and don't have the understanding.
Yeah.
And I just want to say also giving permission for each other to be away from one another. As best you can, take some time away.
Yes.
For their own health. Because if you want to be angry, you don't want your other one to see it. Or you want to be sad and you don't want them to see it. It's very important to spend some time, however you can sneak it away.
Yeah, I'm really glad that you brought that up, and I caught just the sort of tail end of that conversation. But in what we talked about earlier, how do you live the life you want in accordance with your values? That wasn't just directed at patients or just directed at caregivers. That was a general thing. And maybe I didn't sort of stress this enough, but I'll do it now. Right? What do you need to take care of yourself? Right? There's so much focus on taking care of the patient. What does the patient need to be taken care of? How does he or she want to be cared for? And then as the caregiver, what do you need to get your self-care and to get your help and your support around this?
Yeah, it should be really important to the patient to nurture their caregiver because they're so important.
Yeah, I'm glad.
Jill always encourages me to go and do my things. I belong to a book group and I go out and do copies and I do different things. And I encourage him to go out and see his friends and have coffee. And
I drink, I know that.
There seems to be a theme. Maybe we should have a wine tasting one of our times.
Right, and so you raised a good point, and then I think different people I think also have different feelings about that. Some want to feel they want or need to be around their close other so much, and some perhaps have more sort of experience or more comfort, for lack of a better word, to take some time away. So there are differences there.
Right. And when you come back, you see things differently.
Right.
You appreciate
Yeah. And again, each person has a little different thought or, a little different sense of that. So I want to give space for all. I'm aware of the time. I have one favor to ask, which I have a very brief sort of evaluation form. If y'all wouldn't mind filling out, I'd love some feedback, and that will really help me, you know, in my work. So I'll give just a couple of minutes for that. I'm going to step outside of the room, but I'll be available at my little booth or whatnot if you have questions or comments or want to share anything with me afterwards. I am so grateful to have the opportunity to come here and meet all of you. I am so thankful that groups like this exist. It's been such an honor meeting Shelley and Ginger and Bill and so many other folks here. And again, big thank you to Paula and to Tammy for all of your hard work and your support here today. I'm so grateful for the chance to come here. Thank you so much for asking me. Thank you. And I'm going to step outside of the room, but I'll be around.
Just the patients or both?
Everybody. Everybody.
Everybody can.
Go for it. Yes, one of them.